So at Metro Sinus, one of the questions that we get the most often is, what are the sinuses and what do they do? So the sinuses are paired air-filled cavities in the head. So some of the most prominent ones are the maxillaries, which are in the cheeks, and the frontals, which are in the forehead. What's supposed to happen in these cavities, they're supposed to make mucus all day long, a small amount, and the nose has a way of putting that mucus out through a tiny hole, it coming into the nasal cavity and then draining down the back. And that's the way the sinuses and the nose clean themselves. Now, whether it's allergies, a virus, infection, whatever it is, if there's swelling at that opening, it can completely close up. Now, if it does, there'll be a backflow of those secretions. All of a sudden, they can't get out. They accumulate in that sinus, and then you get pressure and discomfort and congestion and all the things that go along with sinus infections.
Absolutely. So once we realized that the cause of all of your symptoms, the sinus pressure and the congestion, was due to the fact that that opening was blocked, we developed techniques to make that bigger. Traditionally, we use something called functional endoscopic sinus surgery. This was done under general anesthesia, for which we used cutting instruments to open that up, and we could make it much bigger. But for that, you could get scar tissue and bleeding and definitely a delayed recovery. Instead, we have developed balloon sinus dilation. Balloon sinus dilation uses a catheter which is inserted into that small opening, and then a balloon is inflated and deflated and removed. An important part is my patients sometimes say, well, there'll be balloons left in my head. Absolutely not. There's nothing left behind. That pressure will then gently expand the bone, and as bone healing happens, that opening is about 6 times bigger than it would be normally. If it's bigger, and even if you get a virus or an allergy or an infection, it is less likely to close off.